their leadership. I thank you.
Thank you, Mr. President. And we are happy to hear from you. And I know the members of the African Union of the Blind in all our 54 states, wherever they are tuned in, and you've been heard. Thank you. And I'd like to move on and take this opportunity to welcome our next presenter, Mr. Nathaniel Mudomi. Is a development consultant who, together with Mr. Edwin Osundwa, who is not here with us today, have worked with Kenya Union of the Blind and the disability movement in the country and the government and other sectors to come up with this evidence-based report. And Mr. Nathaniel will take us through the report and give us an overview and also a thrust of what is contained in the report, including the findings that the report has been able to gather. Mr. Nathaniel, karibu sana, welcome, bienvenue. We will be happy to hear from you.
Thank you so much, Jack, and the WBU team for organizing this meeting. My name, as you've heard, is Nathaniel Mudomi, and I was doing this research together with Edwin Osundwa. I'm representing him as well. We have like 10 minutes to present, so I'll be quick enough. To start with is that Kenya signed CRPD in the year 2007 and ratified in the year 2008. Kenya also subscribes to the SDGs, so which provides a platform for the implementation of CRPD. So a research was carried out, which was commissioned in the year 2019 on October by WBU, IDA, and KUB, who sought consultants who could work to have this report. So this report examines, or to try to examine how SDGs include persons with disabilities in line with the CRPD. So how was the process carried out? This was a national survey, and we targeted 5 counties, mostly where KUB has its operations, including Nairobi, Machakos, Mombasa, Kisumu, and Meru. We had over 3 participants in this research, including the DPOs, people with disabilities themselves, and the government officers. We also did a national validation where we had stakeholders giving their inputs, and the report was finalized. Then the methodology also used online survey to reach people from different counties other than the 5 counties, or in addition to the 5 counties that we targeted. We also used focus group discussions and key informant interviews. Our focus mainly was 5 SDGs, and I'll try to show you how the relationship between SDGs and CRPD. The 5 SDGs, the first one is end poverty, and it's all its forms everywhere. That is SDG number 1. It relates to CRPD Article 5 on equality and non-discrimination. Other articles include Article 12 on control of one's own resources. The other SDG is number 3 on health, which relates to Article number 25 of CRPD on health. Then SDG number 4 on inclusive and equitable quality education relates to Article 24 of CRPD. SDG number 5 on gender equality, it relates to Article number 6 of Women's with Disabilities in the CRPD. And then SDG number 8 on employment, which relates to Article 27 of CRPD on work and employment. So those are the 5 SDGs that we researched on, and that was our scope. I'll only take you through the key findings and their recommendations for each SDG. SDG number 1 on no poverty. It was found out that majority of people with disabilities in Kenya live below the poverty line of less than $1 or thereabout. It was also found that most of the people with disabilities and DPOs are not adequately involved in the development of policies that target them. It was also found that there is no proper accountability mechanism that enables people with disabilities to hold duty bearers to account. And some of the recommendations that were given, there's need for increased advocacy, capacity of engaging duty bearers by the DPOs, need to empower DPOs to generate income so as to reduce levels of poverty. Then the government needs to strengthen accountability mechanisms as per the requirement of CRPD Article 4.3. Then there's this issue of AGPO where that is access to government procurement opportunities, that requires 30% of procurement opportunities goes to people with disabilities, youth, and women. So people with disabilities felt that this percent still discriminates against them, and there's need to further legalize this, put it in a law and segment it further. Then there's need to strengthen the roles of National Council so that it's able to supervise, oversight, and investigate, and also monitor the public services that are aimed to empower people with disabilities. Then SDG number 3 on health, we found out that health services still remain relatively inaccessible and affordable to people with disabilities. And in addition to that is that most of the people do not afford or cannot afford paying for health insurance because of the poverty levels. So we also found that disability-specific services for people with disabilities are not provided in health facilities, such as assistive devices, rehabilitation services, and such. That services that are provided are not relevant to them. Then we also found out that there's inaccessible services because of physical barriers to the health facilities. Then there's distances from where people with disabilities are living from their communities to the health facilities, and also because of transportation challenges that are not accessible. We also found out that particularly women with disabilities are related to stigma. They are not provided well with sexual productive health services and information, because some of the health service providers or the medics feel that these people with disabilities don't have a right to have family planning information, and that is misconception and stigma. So recommendations: promote access of health through scaling up universal health care. That is a government program that is being piloted in 4 counties. So there's need to scale up that universal health care. And also the National Health Insurance Subsidy Program that aims to ensure that people with disabilities and have no income get the right to health. There's also need to waive the charges for assessment for registration of persons with disabilities. We found out that they are usually charged, people with disabilities are usually charged Kenya shillings 500, that is like $5 for assessment. So there's need to waive that charge because some of them are not able, do not afford. And furthermore, the assessment is required, the medical assessment is required to be done at Nairobi, and some of them cannot reach there. Then mainstream disability-specific services in the national health system. Then provide sexual reproductive health information in accessible formats. And that includes braille and also use of sign language interpreters in providing services at the health facilities. Then on inclusive education, SDG number 4, we realize that Kenya has very good policies on special needs education and inclusive education, particularly the sector policy for learners and trainees with disabilities that was launched in 2018. However, people with disabilities were concerned about the implementation of this law. That still we have children with disabilities who are out of school, despite the Constitution of Kenya requiring that every child to go to school, Article 53. Then there was also a worry that despite Kenya ratifying the Marrakesh Treaty in 2017 and domesticating it through a Copyright Amendment Act of 2019, there's still slow implementation of this act, and children are not accessing learning materials, especially those ones with visual impairments. So recommendations is that there's need to fast track the implementation of that act that domesticates Marrakesh Treaty. There's need to do massive enrollment campaigns, specifically targeting children with disabilities to school. And now you can imagine with the coronavirus, now it becomes worse for them. We are not sure whether after schools reopen, if they are to reopen, whether we still have children getting back to school. Then there could also be creative ways of providing alternative education approaches, especially in arid and semi-arid areas of Kenya. For example, in the northern part of Kenya. And on gender equity, gender equality, SDG number 5, it was realized that women and men with disabilities represented in political positions still remain low, below the desired quota. And we found out that out of the elective and nominated positions at all levels of government, that is the county assemblies and national assembly, that we have 1.9% of people with disabilities represented out of the required 5%. So that is a difference of about 3%, which requires still to be addressed. We also found out that women and girls with disabilities are at higher risk of abuse. That is because when you look at statistics for gender-based violence in Kenya, it is quite high even for women and girls without disabilities. Like the other day, we had a lot of girls having pregnancies. So we can ask ourselves how many girls with disabilities are pregnant. So it was found there's the higher likelihood of women and girls with disabilities getting abused, physically, sexually, emotionally, and such. We also found out that there are weak legal aid mechanisms and weak reporting mechanisms, mostly because of lack of awareness and capacity of the girls and women with disabilities. So recommendations: put in place measures such as affirmative action for representation, promote speedy access to justice for women and girls with disabilities, and empower victims to seek justice, among other recommendations. Then SDG number 8 on employment. We found out that PWDs are not adequately benefiting from formal employment opportunities in the public sector and also in the private sector. And actually, there was no data on private sector of how many people with disabilities are employed. So that is a big gap because it seems the government is not so much concerned about monitoring what is happening in the private sector when it comes to employing people with disabilities. I think I've just reported about 1.9% of PWDs are represented in the 3 levels of government, that is the national and county assemblies. We also found out that majority of PWDs have low level of education that makes them lack the relevant skills that market needs, and that is one of the reasons that make them not to get proper jobs or employment opportunities. Then the working environment in most cases are not necessarily supportive of PWDs, including the policies in place, the facilities around moving in buildings where they work in and such. So recommendations, they need to employ, to have Employment Act reviewed so that it compels private sector to employ people with disabilities, not just having a kind of a statement that does not compel them in terms of, compel them legally. Then we could also look at the curriculum. And I think with the current competency-based education and training curriculum for TVETs, it proposes inclusive training. So it is a matter of implementing this curriculum properly and monitoring it to ensure that youth with disabilities are able to get opportunities for training, which will also build their skills towards employment. Then National Council can carry out regular accessibility audits in both public and private employment, employers or offices where they work in, to ensure that the employers are taking this seriously. So we have some general recommendations. We found out that there's a gap in terms of the voice of DPOs in Kenya. And we suggested that the DPOs need to take a more collaborative approach in the advocacy, advocating in one voice so that they are heard wider. There's need to engage media and engagements in advocacy and raising awareness. We have seen media doing great wonders when it comes to reporting other issues of health, disasters, and such. We are saying that it is important that DPOs engage media and also organizations that are working for people with disabilities. Then, speedy enactment of the Persons with Disabilities Act, or bill rather, that is under amendment of 2019, and that it includes services that are inclusive. I saw yesterday an advert in the newspapers by the National Council of Persons with Disabilities requesting the public to provide some input into the regulations, the 4 regulations under the Persons with Disabilities Act of 2003. So I think that is a good step ahead, and I think DPOs can also take can take that one as an opportunity to ensure that their issues are captured in. Then there's inclusion of people with disabilities in the development and implementation of legislation, or rather laws, policies, plans, projects, and programs by the government, so that their issues are taken care of as a way of ensuring participation and discrimination. The other recommendation is lobby for the signing of protocol to the African Charter on Human and People's Rights on the Rights of Persons with Disabilities in Africa of 2018. Then we could further interrogate the implementation of the action plan on implementation of the Global Summit Charter that Kenya co-hosted, I think last year or the other year. Then we should promote self-advocacy by building the capacity of DPOs on international laws, national laws, and such, because we found out that most of them are not very conversant with the international and national laws, policies, and plans. So thank you so much. That is my presentation, and thank you for listening.
Thank you very much, Nathan. Ladies and gentlemen around the world, in case you are joining us, we are unveiling a study that has collaboratively been done by the World Blind Union, IDA, and Kenya Union of the Blind. Our next presenter is Ms. Dorodi Sharma, Inclusive Development Officer for the International Disability Alliance. She will give us a context of the report as part of the Inclusive Works project that IDA is working on. So I have a pleasure of introducing her to submit her part. Welcome.
Thank you.
Ms. Dorodi.
Thank you so much, Jackson. Good morning, good afternoon, good evening to everyone joining us today. Thank you to the organizers, the World Blind Union, the African Union of the Blind, and the Kenyan Union of the Blind for the opportunity to participate in this very important discussion and, in a way, the launch of the SDGs report for Kenya today. As Jackson mentioned, my name is Dorodi, and I'm representing the International Disability Alliance, or IDA, at this webinar. So IDA is an alliance of networks. Together, we have an outreach to around 1,100 organizations of persons with disabilities and their families through our 8 global and 6 regional members. The cornerstone of our work is the UN Convention on the Rights of Persons with Disabilities, or the CRPD. We promote the effective and full implementation of the CRPD by governments and the UN system through the active and coordinated involvement of OPDs, Organizations of Persons with Disabilities, at the national, regional, and international level. The SDGs report from a CRPD perspective is an activity that links to the core of our objectives. The Sustainable Development Goals were adopted in 2015. IDA was at the forefront of the advocacy that led to inclusion of persons with disabilities in the Agenda 2030 for Sustainable Development. This is the agenda for development, the framework that contains the SDGs. Once this agenda was adopted, it was critical that the disability movement connects the implementation of the SDGs with that of the CRPD. One way of holding the states accountable to the commitments they made through the SDGs is to document how they have been implemented for persons with disabilities. The motto that drives the SDGs is leave no one behind. So they will only be truly implemented if they are inclusive of persons with disabilities. The progress on SDGs by member states of the UN are in a way monitored at the high-level political forum, an annual event, through a voluntary national review process. Different stakeholders also submit alternate or shadow reports when countries are up for review at the HLPF, or the high-level political forum. It is critical that persons with disabilities and their representative organizations are also visible front and center during this process. There's a whole area of work that IDA does in the monitoring and implementation of the SDGs. We also have a stakeholders group of persons with disabilities. All this information is available on our website, and encourage all of us participating today, joining in today, to please go and visit our website and look at the vast area of work and the range of activities that we really undertake under the monitoring and implementation work of the SDGs with respect to persons with disabilities. I wouldn't, since I have limited amount of time, I wouldn't really speak in depth about that work. So look at our website, will actually give you much more information than what I'm going to present at this point. So one of the work that we really do in terms of ensuring that the SDGs are also implemented for persons with disabilities is to work along with the members and support our members and members of IDA members to document progress on the SDGs at the national level, even at the regional level, vis-a-vis persons with disability. And this particular area of work, although it was partly motivated by the desire to track the SDGs, the objectives of this work go much beyond that. Because the SDGs and the CRPD are not really mutually exclusive frameworks. The SDGs, in fact, connect human rights to development. So these reports not only speak to the implementation of SDGs in that sense, but also to the implementation of the CRPD at the national level. So they serve the dual purpose of monitoring the human rights element and as well as the development element that the SDGs and the CRPD bring in that sense to the disability inclusion discourse. And the support to IDA members in the disability movement to prepare these documents allows us to bring a lens of intersectionality, basically connecting disability issues to gender, child rights, climate change, budgeting, data, health. Some of these issues of intersectionality were presented by Nathaniel in his presentation of the salient points that was documented in the Kenya SDGs report. And so this is one area for that we bring in, besides the monitoring of the SDGs and CRPD, in that sense, the lens of intersectionality in the disability discourse. The SDGs reporting process through a lens of CRPD also fosters cross-disability work, and it's really encouraging and to see how the work for the Kenya report was led by the Kenya Union of the Blind, but it really spans across disabilities and focuses at the larger impact that SDGs have in the lives of persons with disabilities in Kenya. So it really fosters the cross-disability work and builds a cross-disability advocacy perspective. And I think one of the most important element and the objective really of IDA supporting this work is to also build the capacity of the movement, through the process of supporting IDA members and their members in working on SDGs reporting. We have been able to bring in people with disabilities from different countries, different and subnational level. When we talk about national reports, together we have been able to invest in some of the discussions that that leaders from within and experts from within the country have had towards developing these reports, and some of the discussions have been really encouraging. Some of we also have a training program which is like the bridge, which is called the Bridge CRPD SDGs training program, basically connecting the human rights and development lens. So a lot of our Bridge alumni have been part of this reporting process. So it's a huge investment in that sense towards building the capacity of the movement at the grassroots level in a way. So the objectives that IDA had when we started working on supporting SDGs reporting has been more than just to monitor the progress of the SDGs. And some of the examples that we have had from the reports that we have supported so far has been very encouraging. We've not just been monitoring the SDGs and the CRPD, but also these reports have been used by our members to advocate for national level changes, including CRPD compliant budgeting, disability data collection in national data processes, and so on. So we really hope that even the Kenya SDGs report will also catalyze such further actions. In addition, it is also a very good mechanism to track progress on the commitments made by the government of Kenya at the time of the Global Disability Summit. And Nathaniel also alluded to that we really need to use this SDGs report from Kenya, from the lens of CRPD, to track not just SDGs and CRPD, but also the other commitments that Kenyan government has made at various forums. And as Jackson mentioned, I'm also here to talk about the Inclusion Works program, which is one of the programs that funded the Kenya SDGs report. So the Inclusion Works program is also connected to the Global Disability Summit in that sense. It was launched at the Global Disability Summit in 2018. It's a consortium program, so it's a very new way of working where 11 organizations have come together to work on inclusive employment. This is funded by the Department for International Development, Government of UK, DFID. And it's operational in 4 countries, Bangladesh, Kenya, Nigeria, and Uganda. IDA is a DPO partner in this consortium, is also part of the executive group of partners. The objective of the Inclusion Work program is to develop and test CRPD compliant innovative interventions that create greater access to employment for persons with disabilities in the formal labor market. Within each of the program countries that I mentioned, Bangladesh, Kenya, Nigeria, Uganda, the program focus is on specific industries with contrasting characteristics and contexts that help us create, ideal inclusive formal employment pathways. In Kenya, some of the sectors that we're focusing on include finance and banking, mobile telecoms, FMCG, the fast-moving consumer goods, also hospitality, through one of our partners in the program. The larger idea of the Inclusion Works program is to develop models based on CRPD standards. So models of inclusive employment based on CRPD standards that can be replicated elsewhere. And also to generate evidence on what really inclusive employment as entailed under Article 27 and also linked to the SDG 8 really means. The Kenya SDGs report focuses on SDG 8. It's one of the goals that the report focuses on among the 5 areas that Nathaniel presented on. So SDG 8 is on decent employment. The findings of this report is therefore very critical and useful for the Inclusion Works program in Kenya, as it reveals some of the barriers such as the lack of reliable data on employment, the lack of inclusivity of workspaces, accessibility, and also the challenges that people with disabilities face in accessing higher education or technical skills. So these are some of these barriers that even we, as we are working on Inclusion Works program in Kenya, are finding out. Some of these have been illustrated in the report. As I mentioned, SDG 8 relates to Article 27 of the CRPD, but it does not exist in isolation. SDG 8 or Article 27 does not exist in isolation, like all other human rights and development issues. The connection with health, education, poverty, even gender. So these are the focus areas of the SDGs report in Kenya that we just heard from Nathaniel about. So these are all connected, and so it brings a larger lens to our work as well, in that sense, to the work of Inclusion Works by documenting some of the essential conditions are necessary when you talk about inclusive employment. One of the ways in which IDA is working in the consortium, as I mentioned, IDA is a DPO partner of the consortium. So one of the ways in which we work in the consortium is to support all our partners and the program at large to be include or meaningfully engage persons with disabilities and the representative organizations across all levels of the program, and also focusing on the diversity of participation. So also keeping in mind the engagement of underrepresented and marginalized groups. And IDA, along with our member in Africa, the African Disability Forum, has recently recruited a DPO engagement officer to support this work. We are working with UTPK, United Disabled People of Kenya, which is the national umbrella, but we also want to have greater level of engagement. So, we look forward to working closely with the Kenyan Union of the Blind as well. I've shared this report with the Inclusion Works Consortium and with ADF and our DPO engagement officer in Kenya. We hope that moving forward, we will be able to use this report in our work in Kenya under the Inclusion Works umbrella. In addition, the report comes at a time when COVID-19 has highlighted some of the existing inequalities that persons with disabilities face in terms of employment. And not just that, it is also, the pandemic has also exacerbated some of these existing inequalities. If we look at the labor market, people with disabilities are not only at a higher risk of losing jobs, but also have a much lesser chance of finding employment post the pandemic. So this report and its findings in that sense can inform the work that IDA, IDDC and other partners and the Inclusion Works program as well are undertaking in terms of rebuilding post-pandemic, especially in Kenya. So this will be a useful, very useful resource for us in our advocacy to build back better. I'm conscious of the time, so I wouldn't want to go further and would like to stop here. I'm happy to address questions on the role of IDA, on IDA and the Inclusion Works program. But before I hand it back to Jackson, I would really like to congratulate the World Blind Union, the African Union of the Blind, and the Kenyan Union of the Blind, and everybody involved in this very excellent report. And thank you once again for inviting us. It has been a very informative presentation so far, and I'm really looking forward to listening to the later presentations. So thank you once again, and please visit our website, the International Disability Alliance website, for more information on our work on SDGs. Also visit Inclusive Futures website. Inclusive Future is the name of the consortium in which Inclusion Works is a partner. So just visit that Inclusive Futures website as well for more information on the work that we do around employment under the Inclusion Works umbrella. And again, happy to answer any questions later on during the Q&A session. Thank you so much. Thank you once again.
Thank you very much, Madam Dorodi, for those very rich insights. I know this is a very critical information to our members and our stakeholders, especially the government here in Kenya. At this point, I would like to recognize or acknowledge some of the comments that are being sent via chat. I can see there is Paul Mugambi. Thank you very much for your comments. Nathaniel, I think there is Lucy Odhiambo. Thank you very much. Jared Mosota, thank you very much. Elisha Orlando, thank you very much for your comments. And I would like to encourage all other participants who have comments or questions can post them, and our panelists will be able to answer when they can. At this juncture, I would like to introduce Dr. Chomba Munyi, who is first and foremost the chairperson of the Kenya Union of the Blind, but also has a national stature as the vice chairman of the National Gender Equality Commission. He is a commissioner appointed by the president to serve in that commission on behalf of persons with disabilities in Kenya. So Dr. Chumba will give us brief insights on the linkages between the implementation of sustainable development goals and the gender equality in Kenya. We also get to know what the Commission has in store for the persons with disabilities in Kenya. Dr. Chomba, karibu, or welcome.
Thank you very much, Jackson. Colleagues all over the world participating here, and the president of the African Union of the Blind. Good morning, good afternoon, wherever you are. It's my pleasure to introduce the linkages that we have as the National Gender Commission between the SDGs that have been highlighted here and even researched into, and gender. I want to begin by introducing Gender and Equality Commission, which is a national organization established by the Constitution of Kenya, Article 2011. Yes, in the year 2011, just roughly 10 years ago. We have a wide mandate. I'll not be able to explain it all, but our concern, mission, and vision is to promote gender equality and equity and freedom for all persons in Kenya, with a special focus on women, youth, persons with disabilities, children, the elderly persons, minorities, and the marginalized groups. So you see, we have a very wide mandate. And within this mandate, then we have been given specific functions. I'll only address issues pertaining to gender, as it were. Primarily, we are so concerned about the gender violence, SB gender violence, particularly when it comes to violation of rights of women, and particularly women with disabilities. We do this, we are able to execute this kind of function in collaboration with DPOs in Kenya. And Kenya Union of the Blind is one of our major stakeholders. We normally invite them. When I say we, I mean, I'm now representing not KUB, but the Gender Commission. We normally invite them to all activities that have to do with persons with disabilities. And this has been our tradition. We value inputs of persons with disabilities. With reference to CRPD, it's the domestication and the implementation. The Gender Commission, NGC as we call it, National Gender and Equality Commission, what we normally do, we write advisories. We advise the government of Kenya with regard to areas and issues that we realize are sensitive and are abusing the rights of persons with disabilities. Recently, we have had to engage the government on what the World Blind Union is very clear about, the inclusive urban transport. Persons with disabilities were highly represented, and before we decided or were able to go to Abu Dhabi to attend the WF forum, presenting the feelings and issues as pertains to problems encountered by persons with disabilities in inclusive or accessible inclusive transport in Kenya. We held several forums with persons with disabilities. Now, that is a very important one. With regards to education, it has been referred to by the researcher Nathaniel, I believe, Article 24. We are concerned with inclusive education. And what we do, we audit compliance with policies pertaining to special needs education, and we have done that one at primary and secondary school level, and advised the government accordingly. But what is more important in all these advisories is that as far as Gender Commission is concerned, we write our reports, we publish our reports, and send them to Parliament, the National Assembly, where debate on these issues can be carried out, and finally ending up with our executive employer. The President of Kenya receives these reports on persons with disabilities at the national level on a yearly basis. Needless to say, we go as far as other international forums like ICRPD, where we also articulate as a gender commission issues pertaining to disability in Kenya, and ensure also that persons with disabilities, few delegates, are able to participate and attend those international forums, and that is happening. I would also like to say that we are concerned with inclusion of women, particularly women with disabilities, in all issues pertaining to law, policies, programs, and other administrative procedures. This is because the National Gender and Equality Commission, as I've said, promotes freedom from discrimination for all persons in Kenya. And we do not hesitate to advise the judiciary of Kenya, parliament, or other bodies, even where discrimination is cited in public and the private sector. This we have done successfully, and we are doing it. Currently, as I'm talking to you, we have decided to open up procedures. We call it complaints handling mechanisms and procedures, where persons with disabilities and other Kenyans can present their complaints to the gender department, legal department, so that we can advise, listen to them, and intervene where necessary. This is very important, and is currently done. We have realized, as the researcher said, Nathaniel said, that women with disabilities, the visually impaired, hearing impaired, intellectually challenged, are being abused almost on a daily basis, and the cases are enormous. So this is one area where we have intervened. Another area, as I have said, is public education for all. We are trying to say, and we are telling the nation, that gender, that is women and men, because in Kenya here, gender does not refer to women, but to men and women, or even to young children, girls and boys. The boy child in particular has been left out, has been left behind, and we are trying to say all these children, both boys and girls, have equal rights. No one should be treated, be prioritized when it comes to fair treatment. So that is what we are doing. We have other issues. For example, when it comes to access to funding for men and women with disabilities, we make sure that they have access to funding opportunities, like Nathaniel was talking about AGPO, that access to government procurement opportunities, youth fund, women financing, and so on. This gender, when we realize that there is any discrimination, we do not hesitate to write or to come up with advisories. We are collaborating with the National Council for Persons with Disabilities, with other disability organizations, and in short, I would like to say we have a department specifically for this. We have for persons with disabilities. We have a department also for women, which deals specifically with violence against women and other economic issues. And finally, I want to say that also deal with research and coordination of research. And this is an area where, having listened to the presentation by Nathaniel on that small scale research, we can collaborate with World Blind Union, of course, assisting us, and other organizations to come up with a large scale research, particularly after a pandemic, as my sister said over there, so that we can highlight the issues and the impact on persons with disabilities when it comes to inclusion and also being assisted to alleviate poverty among them. We would like to do a national research in almost every area that touches persons with disabilities. For example, what is it that can improve inclusive education in Kenya? At what level are we in? To what extent can we guarantee educational personnel provisions and access to persons, particularly the youth with disabilities in this country? I will say only that, but I want to say that Gender and Equality Commission is very ready to work with persons, with organizations like World Blind Union and others. But one other area that has concerned us, and now I'm ending up, it has to do with access to health services. We want to be sure that, as Gender Commission, that women particularly have access to hospitals, to health facilities without discrimination, because there has been a national outcry among women and even youth with disabilities, sometimes amounting to discrimination, whereby, for example, persons are misunderstood in the sense that people believe that only a blind person should, only a person with a guide should be received at the hospital level so that it can have an interpreter. They don't believe these negative perceptions. We are trying to eliminate them. People feel that persons, particularly ladies with disabilities, should not have access to maternal hospitals and other places where they need health services. We have seen this, and we also want to ensure that there is barrier-free environment, even those hospitals, so that those who are using wheelchairs can access those places with ease. People with hearing impairment also have had a lot of problems due to lack of sign language interpreters. And as you know, these are requirements in SRPD. We do not tire of writing advisories to relevant departments where we realize this kind of discrimination. With those few remarks, I thank you.
Thank you very much, Dr. Chomba, for those insightful remarks. I think we are conscious of time, and I'd like to encourage other presenters to be as brief as they can so that we keep time. Madam Angeline Akai is an immediate member of County Assembly and experiences.
Hello, can you hear me?
Yes, hello. Good evening to you, Angela. You can proceed.
Thank you very much, Jack, and all other members. Good morning, good afternoon, good evening, depending on your time zones. My name is Angelina Kai. Just want to share a few of my challenges and experiences as a woman with disability who has been more in advocacy and was in politics once, and currently really working together with able minds in advancing the rights of women with disabilities in a network, Kenya Network for Women with Disabilities here in Kenya. Thank you very much for the report. I know that it will go a long way in ensuring the rights of women with persons with disabilities as a whole is brought to another level. I mean, implementation and all that. First, let me share my challenges because I'm very sure that we share these challenges as women with disabilities here in Kenya with regard to politics. There are different angles. In politics, there are several barriers. I was privileged to have sat in the previous county assembly, that was 2013 to 2017, whereby I was able to work with non-disabled person in Tharaka Nithi County Assembly. And my mandate was in oversight, legislation, and representation of persons with disabilities in the county assembly. The challenges are, like Nathaniel has alluded. Currently, I think the number of women with disabilities, or persons with disabilities, has really decreased from the previous era, from 2013 to 2017, with regard to nominations or even election. But I know that something needs to be done, or there are barriers that has led to the same, including the charity approach of disability, whereby people are treated, persons with disability are treated as an afterthought whenever anything comes on board, like policies or even distribution of resources. We are treated as an afterthought. So with that, really we need to put compelling policies that will let us, or allow for, equal distribution of resources to persons with disabilities. And again, all sectors of disabilities, we have other marginalized sectors, categories of disabilities who are under or not represented at all in the political spheres. So a lot needs to be done to streamline these challenges with regard to political representation of persons with disability. I am very grateful because again, with these challenges, a lot has taken place, and a lot of policies have been put in place, especially in the grassroots, that is the county level. Persons with disabilities have not been left behind, or rather, a lot needs to be put in place. And we need to add more effort in ensuring that representation is key, or goes higher, on a higher note than right now. And again, I want to applaud the network that we work with in the Kenya Network of Women with Disabilities, who have seen the challenges that women with disabilities are facing with regard to sexual reproductive health rights, sexual abuse. A lot of women, there's a higher rate of women with disabilities facing abuse and victimization and all that. And the network is really coming on board a lot with the little resources to ensure that the culprits, for example, are brought to book, who violate, who abuse the women with disabilities, and also empowering the women to know their rights and the approach to take if or when their rights are violated by many. So we currently have the challenges with regard to the justice system, the legal aid, which of course I hope the SDG report has also clearly stated that we need to put our advocacy team on a higher alert to support the women with disabilities who are going through the same abuse and who don't know their rights, or if their rights are infringed upon, how do they go about it? We need to empower the grassroots women to be able to stand for themselves, or to be their self-advocates at the grassroots level. Thank you very much. I will not talk much. but I really appreciate the good job Kenya Union of the Blind, in conjunction with WBU and IDA, is doing in ensuring that we advance the rights of persons with disabilities. And together we will work and ensure that this is we forge the way forward and put our collective strength together in ensuring that the recommendations in this report is implemented by all sectors. Thank you very much and have a wonderful time.
Thank you, Angela, and thank you for your presentation and those insights. And we applaud the role that your network is doing to transform lives of women with disabilities in this country. At this juncture, I'd like to introduce Mr. Wycliffe Busaka, who is the representative of the Ministry of Labor and Social Protection. And it's important to note that the Ministry of Labor and Social Protection is the principal ministry that disability matters are domiciled in the country. And he will give us insights along commitments that the government of Kenya is undertaking through the lenses of the Global Disability Summit Action Plan. And I really want to welcome you, Karibu Sana, Peter. Wycliffe.
Thank you, Mr. Bufana, and the entire Union of the Blind fraternity, plus our partners all over the world. Thank you so much for this invitation. I'll go a bit faster. First, the Ministry of Labor and Social Protection, as the moderator has rightly said, is the one that takes care of issues of disability in the country. That is why I think this invitation is really appreciated. I'll rush through very fast, linking what we have done or what we need to do as far as SDGs are concerned. And before I do that, because I may forget, let me appreciate the work that was done in bringing out that report that we were ably taken through. It was quite a good report indeed, very factual. And it raised very fundamental recommendations. So first, the first SDG on poverty. I think that the issue of poverty and disability are sort of inseparable. Disability can predispose somebody to a lot of stress that can cause poverty, much as poverty can also cause disability. So as a result, there were some households in Kenya which take care of persons with severe disabilities. Those are the ones we defined as those who require 24-hour care. Now it means that the caregiver cannot go for work. So what the government decided to do was to give a stipend to the households that have this kind of persons with disabilities. And so far, the number is still low, but it is premised on the fact that these caregivers need to get something on the table for the family to eat, and yet they are taking care of persons with severe disabilities. So that is one intervention the government put in place to cushion these families which have persons with severe disabilities. It is important to note that the numbers are low as compared to other cash transfer programs. That is noted, and I think the report also noted that. Number two, on SDG number 3, good health and well-being. You also note that through the National Council for Persons with Disabilities, the government of Kenya provides sunscreen lotion to persons with disabilities, to persons with albinism. This is meant to prevent these persons from getting skin cancer because of the sunshine. And at the same time, the National Council for Persons with Disabilities provides protective clothing like hats, glasses, and others so that they are not exposed to sunshine whenever they are working. Universal healthcare. The person who was presenting the report mentioned this. We are having a pilot in 4 counties, and we hope that from the lessons learned from these counties, the government will roll out to other counties and the entire country this program. And as a result, persons with disabilities will benefit from this program. It is important to note at this juncture that among the big 4 projects by His Excellency the President, universal healthcare ranks highly. And then on quality education and training, the government has consistently increased capitation grants for free primary education and subsidized secondary education in the country. This, as a result, has increased enrollment at both levels. And currently, we are talking about 100% transition. Much as we have challenges in this, but it is meant to get every learner in school. For example, the government set aside funds for the establishment for the purchase of assistive devices and technologies in schools to a tune of 22 million shillings last financial year. This shows the commitment of the government in as far as quality education is concerned, particularly education of learners with disabilities. And then it is important to mention also that the government runs vocational rehabilitation centers, 12 of them throughout the country. And as we were closing before COVID, these centers had 800 learners. So it is important to note that the government takes education and training of persons with disabilities or learners with disabilities very, very seriously. We heard during the presentation of the report that the Ministry of Education has very robust and progressive policies that touch on special needs education and inclusive education. It is important that to note that these policies, if well implemented, will go a long way in giving quality education to learners with disabilities. On decent work and economic empowerment, SDG number 8, it is important to note that our Constitution of Kenya 2010 allocates 5% of all appointive and elective positions to persons with disabilities. Much as we have not gotten there, but the fact that the Constitution talks about it is, I think, a positive thing. We only need to grasp and grab the opportunity and run with it. So what we are doing, we are raising awareness on this particular constitutional provision. And then the 30% AGPO, access to government procurement. This is there's still a challenge because persons with disabilities women and children are supposed to tap into this opportunity, but the uptake is still low. We are still encouraging and creating awareness on this particular opportunity. The National Council, for example, has LPO financing arrangement where persons with disabilities, if they obtain or they get a government tender, whether it is in government or its agencies. Next, on creating awareness, I wanted to mention also that as part of the Global Disability Summit, we have created a booklet that is going to guide in awareness creation. Very soon, it was launched during the International Disability Day in Makueni last year, and we are ready now to do mass awareness creation across the country and in partnership with our partners. At the same time, we created a national disability mainstreaming strategy that is going to guide the implementation of the commitments. And on the ratification of the African Protocol, I wanted to report, I'm happy to report that we are at an very advanced stage in the ratification of this protocol, and it is part of the commitments that we made during the Global Disability Summit. At the same time, during the last national census, the government used the Washington group of short questions in capturing the data for persons with disabilities. I think my colleague also will have some bit of time to also mention a few of these things. So allow me to end there, and thank you very much for this invitation. Thank you.
Thank you very much, Wycliffe. We are so proud of what the ministry is doing and intends to do to support the cause of disability in Kenya. I think at this juncture, I would like to welcome Mr. Peter Musaki from the Ministry of Devolution and Planning. And Peter is, apart from being a government public servant, is also a friend to persons with disabilities for many years. He has been very, very, very much committed to the cause of disability. And I'll welcome him to give us his remarks and the role that the Ministry of Devolution is doing to support the cause of disability mainstreaming. Karibu, Peter.
Hello? Am I clear?
Yes, Peter, you are clear. Karibu sana.
Okay, thank you. Now, as you mentioned, Jackson, I'm from the Ministry of Devolution and ASAL, not planning. Planning is with the Treasury. So with the ASAL means arid and semi-arid land. I'll be brief. Now, the Ministry of Devolution is concerned with the seamless implementation of programs and projects that is between the national and the county level, so that we are collaborative, consultative, way of understanding our programs and implementing them together between national and county levels. And while we are doing this, I'll say that we are concerned with implementing SDGs, or disability for that matter, through SDGs, through Vision 2030, through the various medium-term plans, various plans for yearly plans, and even shorter plans. Now, we are aware that recently, as Busaka mentioned, the government of Kenya has focused on implementing the Big Four agenda. That is food security, housing, manufacturing, and universal health, just to seek to address those areas that concern Kenyans more in the current situation. And as we do this, as Kenyans, and as we do this between the national and the county governments, then we are also concerned with how much we implement the concerns of persons with disabilities. Because in the SDGs, there are issues of persons with disabilities. In the Vision 2030, in the MTPs or medium-term plans. So the national government, that is the Ministry of Labor, Ministry of Devolution and the ASAL, works closely with various counties through Council of Governors to ensure that their work plans are integrated in such a way then that they accommodate all. And I just want to mention here that we are seeking to remove what we call inequalities. And inequalities are in which areas? One, gender. Another inequality is in race, what you can want to call tribe, but I'll call it race. Another inequality, you can call it disability. Another inequality is in age. Another inequality is in geographical access, and also in indigenous communities. So then, as at national level, I'll say that we are concerned with the alignment of SDGs to the Vision 2030. And we do this through what we call sectoral policies. Now, sectoral policies, like we have 17 sectors. Right now, there are 17 sectors. And I think disability now falls under what we call social sector. Now, the social sector then is where we discuss disability matters. So we bring together all players in the social sector, from budgeting, from planning, from those indicators that are in the SDGs, in the CRPD, you can say that, and see how those indicators are budgeted for. We also discuss what we call sectoral budgets. Now, at county level, we have what we call county integrated development plans. And those county integrated plans also accommodate the concerns of persons with disabilities. Because we are talking about provision of water, then you must ensure that this water is accessible. If you are talking about county strategic plans, county sectoral plans, all those, it is now the interest of persons with disability at the county level to engage with the counties to ensure that their concerns are taken care of in. And as a ministry, we have recently developed what we are calling intergovernmental implementation of national programs in the counties. That's a new framework that has just been gazetted the other day. I mean, that was in March this year. The government has gazetted what we call an intergovernmental framework for implementation of national programs and projects in the counties. And that is now targeting these 4 big agenda and any other agendas that are going to come as national. I'm saying this because you're aware that if you look at the devolved functions, disability, for example, is sometimes confused to say disability is not devolved. But you're talking about people, and people are everywhere. So you cannot then say limit it. However, to address those concerns, like the national government is coming up with now with universal health, is coming up with the food security programs, though they are devolved by their national programs. The Big Four agenda are national programs. So how are they going to be accepted in the counties in an easier way? So we have developed that framework, and all of us can check on the websites of the Ministry of Devolution. You can also go to the AG's website and you get those frameworks there. Now, we have also established what we call units in each county, or we are working towards that. Not all counties have done that, but a few counties have established units in all counties. So in those those units, we can engage as DPOs. We can engage counties through what we call devolution units, so that you can then bring in your issues as a DPO or a person with a disability, so that those issues then are taken care taken over by the county government in their planning. We have also developed what we are calling Jukumu. Jukumu is a public participation exposé, and we have used it to do a lot of sensitization, capacity building of Kenyans, how to engage with their county leadership. And I want to call the persons with disability now through this and other forums we've done that, to use this kind of approaches to engage county leadership. Yeah, so the county leadership can see that it's important to integrate their concerns. You know, when you talk about disability, like I'm sure there are so many counties that are lagging behind, even in terms of employment, where few counties have persons with disability employed, right from county assemblies and even the executive. And though there have been issues, but I think some counties are accepting. So there is need to continuously, because devolution is a new phenomenon in Kenya, and I'm sure as much as you may say is a treating matter, maybe we are not growing, but you can continue engaging counties. Now, but then disability and many counties and even SDGs have been left behind. We're so much behind on SDGs in many counties. And we continuously engage counties together with the Ministry of Planning to adopt SDGs and widely understand what SDGs are, so that we are also able to use that SDG platform to bring in the concerns of persons with disability. So what do we need here? We need what we call ownership of goals. The counties need to own those goals, because some counties always say some of those goals look a bit difficult or they look more of national. Number two, there is huge challenge of data, because without data you can't plan. So we require counties to do a lot of soul searching, using the data that is available, studying around the data they can get within the counties. Number three, another challenge is what we call intergovernmental coordination. It's a big challenge, because we require counties to work together, to coordinate between the counties and also counties and the national. And the counties with the persons with disability through their DPOs, and the counties with the various international, local, national DPOs, working with the local national DPOs to really emphasize and implement the concerns of persons with disabilities in the county. Of course, the last one, though it may not be the last one actually, funding of county goals funding of county governments. Of course, funding is an issue, and you can even, you're aware that right now we're still struggling with the budget issues and the whatever formula. Yeah, but still going forward, engaging counties and supporting counties, various national and international organizations, supporting counties and the workers with the disabilities in the counties to use their knowledge, they use their information to really reach other leaders within the counties. Because you see, in some counties we have MCAs, what you call county assembly representatives. We have also what you call chief officers who have disabilities. So we will require national institutions, national DPOs to use some of these persons with disability as a landing stone to reach the leadership in the counties. I know there's not much time. I wouldn't want to go so much, but I've had issues like poverty, employment, health, inclusive education. Those are not as easy as such, but I'm sure that something is happening, because if you talk about education, where counties get concerned, they're concerned with the pre-primary, maybe vocational and others, and I think the means of education, we're lucky that we have like Haga there. I think they're now readily engaging counties, developing some of the documents, materials, curriculums, to engage the counties to adopt into their, supporting the counties to start training, supporting children with the disabilities to go to school. So there is so much that is happening that I cannot list them here now. But what I'm saying here in a nutshell is that the ministry is already adopting the interests of persons with disability within their plans. And recently, last year, you're aware that we had a devolution conference. And for the first time, we brought persons with disabilities to participate at the center of it and ask questions and also make their presentation. So going forward, we're hoping that we are going to be engaging persons with disability in every devolution conference for them to engage county leadership, to air their concerns, and ensure that counties then, starting small, are able to see the value of persons with disability at the county level as any other human being, and not as a different institution totally, because they just talk about a person anyway. Thank you. Thank you, Jackson.
Wow.
Back to you.
Thank you very much, Peter. Thank you, Asante Sana. We are very happy to hear from you and the role that the ministry is committed to do towards advancing disability issues. I have a few announcements, and one of those is that there's a link on the WBU website where you can download and access this report. And I think that is very important for our participants across the world. Other links will be shared later where these reports can be availed. And also our panelist, Ms. Dorodi, will be leaving shortly. So in case someone has questions or comments or more information regarding, whatever you want to hear from Ida, you can just post, and of course, will be shared to you through email. Terry, I don't know how much time we have, and before our executive director, CEO WBU, Jose Vieira, can give us his remarks, closing remarks. Terry, you will guide me on this.
Sure. We are already past time. We were to end at 10:30 Eastern Time, 5:30 Kenyan time, but I think the discussions are going very well. So I would suggest we pick up one or two questions, and then our CEO can close. And then if there are more questions, because we have emails of everyone, then please feel free to send us those questions by email, info@wbu.ngo. We are going to post that address on the chat box. Please feel free to share your questions, and we are sorry that we're running short of time, but we will get back to you with answers. So 2 questions, please, only for now. And one of the questions that was posted, Jackson, just to assist you on the chat box, was disability causes poverty and poverty causes disability. How true is that? So I think that's a general question that any of the panelists can pick up. Jackson, are you there?
I'm there. Any of our panelists can pick
I don't
up
think
that
that is. Hello, yes. I don't think that is correct. This is Dr. Chumba. Because if disability was to cause COVID or vice versa, then of course, COVID should be as old as disability. And you know how disability is. Disability is as old as humanity. So I think that will be a very wrong perception. And in fact, I think it is an abuse to the dignity of persons with disabilities. Thank you.
Thank you, Dr. Chomba. I think that's part of the stereotypes that Nathaniel presented in the report. And thanks for correcting that. And then this question goes to Nathaniel. In the findings and recommendations read by Nathaniel, he said that those representing people with disabilities in both county assembly and national assembly are about 1.9% less, 3.1. The majority of those people in this position are people with physical impairment. Is there a way of how political parties could be advised to practice equality in the nominations of all categories of disabilities? So I think this goes to Nathaniel as well as our government representatives.
Thank you, Terry. I think this is where we are recommending that DPOs could be built, could be trained, their capacity could be enhanced so that they can do self-advocacy. Because now these are issues that matter for them, how they're represented in the parliament, the National Assembly at the county level. They should lobby for these and ensure that it is somewhere. And I think most of these policies, they're called what? Constitution of the parties, political parties. I think they have some some provisions for having people with disabilities. But then the issue is, how are they implemented? So I think now the issue of advocacy comes in seriously. Thank you.
Thank you so much. I'm not sure if Peter and Wycliffe want to add anything. If not, yes.
What was the question? I didn't get it clearly.
Okay. In the findings and recommendations read by Nathaniel, he said that those representing people with disabilities in both county assembly and national assembly are about 1.9 less. The majority of these people in this position are people with physical impairment. Is there a way of how political parties could be advised to practice equality in the nominations of all categories of disabilities?
Maybe Busaka can say something, but from where I stand, it is possible, and that will be the work of UDPK and persons with disability in Kenya. Of course, maybe they will also demand that then there's some election, some kind of nomination process, because then how does a party identify who is going to represent them in the National Assembly to be nominated, or in the Senate, or in whatever assembly county? Then there is also need for maybe persons with disability to caucus, to do some kind of identifying their person who represent them in that party. There should be some kind of openness, rather than the party choosing themselves whom to put there. maybe that can be, though it can be very difficult, but the National Council, UDPK, and even through the ministry, we can have an engagement with the various parties. You need to convince them, you need to have a lot of discussions, seminars, to let them understand that this is doable. For me, it's possible. You don't run away from it.
Okay, thank you. The last one.
Thank you.
I wanted to add some.
Yes, Wycliffe.
Thank you very much. Most of it has been said. The issue is we should engage with political parties, especially at the leadership level. You know, there is a misconception. I think it's because, I don't know if it is because physical disability has more people, or that is what you see at a glance. There are some disabilities that may be hidden, and the leaders may not even be aware of them. So there is a need for us to engage them, both the government, the persons with disability themselves, and other social partners who work in this area. Education is very important. And I don't know, the first question where my senior responded, I don't know if it was COVID or it was poverty.
It was poverty.
It was poverty.
Yes.
Okay.
I thought it was COVID, but either way. Sorry, was it poverty?
Yes.
May I say just one word about poverty? Well, yes, poverty does not cause disability, but it can worsen disability. I think it would be unfair to attribute disability to poverty, because even in the developed countries, we have persons with disabilities. So I think that will be, again, another very serious misconception.
Thank you, Dr. Chomba, for clarifying that. The last question goes to you, actually, and Honorable Angelina. We have realized performance of girls in national exams are declined. Do you think would it be appropriate to have single-sex special secondary schools rather than mixed secondary schools so as to enhance performance in academics? So any of you can respond to that, or probably...
Let me answer that.
Yes.
Let me respond to that. I happen to be an educator, and I've taught at the university as a lecturer for quite many years. I have not seen underperformance by women with disabilities in my classes at the university level. In fact, they were at par. And I don't think segregating women just for the sake of improving performance would be the answer. I happened also to have been in a special school, at least for a few years, before I joined mainstreaming, integrated or inclusive classes. The women were defeating us. I mean, with disabilities. My classmates were as good as we were, if not better. So I don't think really we should attribute mixed schools, whatever you want to call them, to underperformance of women with disabilities. We should not segregate at all. After all, our policy in Kenya, special needs education, is hinged on inclusive education. We only segregate those people with severe disabilities, like intellectually challenged. But other disabilities, I think, are just as equal as in terms of performance. Thank you.
Thank you, Dr. Jared. Before I hand over to Jackson to continue with the program, there's a participant who is really insisting on asking a question, Jared Mosota. Okay, I think we should proceed with the program. When he comes back, he can ask his question. Over to you, Jackson.
Thank you, Terry. And we are happy that at least our participants have gotten some of their feedback. I think without much ado, I take this opportunity to welcome Jose Vieira, the Chief Executive Officer of World Blind Union, to give us his closing remarks. Welcome, Jose.
Good afternoon, everyone. On behalf of the World Blind Union, our president, Dr. Frederick Schroeder, and the entire WBU family, I would like to, first of all, express our gratitude in developing this report. Very out the human working in the last 8 months. This report elaborated to take this opportunity to thank Jessica for the great support process to the people and using these reports. Basically because most of the important, but if a report has, of course, many different ways to be used, but at least two main ways out is that where people with can, and that is what we have tried to achieve through this report, to give people in Kenya to share with the community what they say around the SDGs and the web. And also recognize that this report is the first have. The second, taking advantage of this report is for people with disabilities in Kenya, and other civil society organizations.
Sorry, Jose, to interrupt. I think we are having audio issue. We can't follow you very well. Sorry.
All right. So let me see.
Yes, much
is it
better.
now? Okay. Thank you. I'm sorry for that. I was just saying that the second way of and using this report is basically as an advocacy tool, and that is exactly what DPOs, government, and other civil society organizations can do when interacting among each other. This report should be an advocacy tool to see how we can better implement the SDGs. The last but not least way through which this report can benefit the disability community and Kenya in general is that this report, this document, should be a place to visit in 1 or 2 years' time to see what has been the progress made in advancing the right of people with disabilities. This report aims at being a platform where we can come back anytime and check what has been done, what has to be improved, and how we can even better partner to implement the SDGs and the CRPD. I will then conclude by, again, thanking the great people involved in this report, and also to encourage everyone to use this report in the best way possible to promote the right of people with disabilities. Thank you, Jackson.
Thank you, Jose, for those wonderful conclusions. And that gives us a way forward on how we can move forward. I think at this juncture, I'd like to thank everyone, especially the WBU Secretariat that has worked tirelessly to ensure that this meeting has been successful, and also our panelists who within a very short time were able to turn up and be part of this wonderful convening, and all participants who have dedicated their time. We pray that all of us are safe, especially at this difficult moment of the COVID-19 pandemic. And from Kenya Union of the Blind Secretariat in Nairobi, I think I'll hand back to Terry to close this forum. Terry.
I think mine is just to thank everyone and participants, panelists for attending our webinar. We truly appreciate. This is a very important report. It's not just relevant to Kenya, but it's a report that makes a lot of sense worldwide. So please feel free to circulate it to your networks, to your colleagues, to members and other organizations. And we will send a link of the report and today's recording by email. So that's about it from me. Again, once again, thank you, panelists. Thank you, participants. We appreciate you attending this wonderful webinar. Thank you.